patients regularly. The most important part of a mask. On a regular day when patients arrive at a hospital, some of them will be very ill, requiring immediate treatment. Some will have to get treatment fairly soon, but can wait a bit. And some will have an illness, but are not severe. They are not acute. If the patients would be treated one by one in order of arrival, some of the more severe patients might be treated too late. That's why health facilities practice triage. They assess each patient quickly to help the sickest patients first. When a mass casualty happens, many patients arrive at the same time, and there might not be enough staff, supplies, and space to provide care according to each individual's needs. To save the most lives, the focus needs to shift to doing the best for the most. The mass casualty plan is activated. Staff members are called in to help. Zones and supplies are readied. The scene is made secure and crowds are managed to make sure staff can work safely. The triage shifts from routine to mass casualty. Anybody who can still walk is directed immediately to the green zone. Others are assessed as quickly as possible. The assessment is based on 5 criteria. Is there massive bleeding? Are they breathing? How fast are they breathing? Are there signs of poor perfusion? And are they able to follow commands? If the patient is stable, they are directed to the yellow zone. If the patient is unstable, they need immediate medical care and are designated red. Before they are moved to the red zone, there are 3 interventions that can be done on the spot. Control the hemorrhage, open the airway, and if appropriate, place the patient in the rescue position. After a brief attempt to control bleeding or to open the airway, it is difficult but very important to move on to triaging the next patient. Staying too long trying to resuscitate one patient will delay identifying other patients who are yet to be triaged who might otherwise be saved. When all patients have been triaged, it's very important to consider that their condition can deteriorate quickly. They can go from green or yellow to red. The triage needs to keep going. It's a cycle and not a one-time assessment. The triage cycle continues in the green zone, where patients are checked using high-risk reference card. If they have high-risk conditions, or if they have developed emergency signs in the meantime, they need to go to another zone. In the yellow and red zones, staff also continue to check for high-risk injuries, emergency signs, and use the maneuvers when needed. In the red zone, there might be patients who are too sick to be helped within the limited time and resources available. Depending on the level of training of the staff, these patients will be categorized as blue and are brought to the blue zone. Patients in the blue zone receive palliative care and are reassessed as soon as more resources become available. The triage cycle does not end until there is no patient left to be treated. Please keep in mind that triage is an exhausting physical and mental process. Take care of yourself and your colleagues. Use PPE, give each other breaks if possible, drink water, and debrief together afterwards. Remember, if health workers drop out, no one gets treatment. A few extra but very important points. Children have different respiratory and heartbeat rates from adults. This needs to be taken into account during the mass casualty triage. As we are currently going through the COVID-19 pandemic, it's important to adapt your mass casualty plan accordingly. The main points to take into account are: at one point, you'll need to screen for COVID, but in the case of a mass casualty, it's unlikely you can screen before you triage. Therefore, every casualty and their caretaker will have to be assumed COVID suspects. As soon as possible after the triage and first treatments, you screen for COVID and act accordingly. Therefore, everyone will need PPE, including the guards who do the crowd control. In the COVID-19 pandemic, it's important to realize mass casualties are not just about trauma, but can also occur when large numbers of medically unstable patients suddenly arrive at a facility. Ensure your mass casualty plan reflects this. Please refer to your emergency advisor for more information and if you have any questions. And remember, the most important part of a mass casualty plan is to have one. Thanks for watching.
Perlu diulang nggak? Boleh. Mau sambil dijelasin?